It is an issue that impacts 1 in 5 high school students in Wisconsin. A study shows that's how many underage teens admitted to using e-cigarettes within just the last month. Dr. Meyer and Dr. Amos at Children's Wisconsin say state lawmakers need to address the problem.
So if anything is 18, it's in the high school, right? That's just the easiest answer about it.
In this Lighthouse report, our Ben Jordan goes in depth on why doctors are frustrated with what they call mismatched laws.
You've probably seen these signs outside convenience stores that say you have to be 21 years old to buy nicotine products. It's been the federal legal age to purchase tobacco or e-cigarettes since 2019, but Wisconsin law hasn't caught up. It's still age 18 here. While federal law takes precedence, experts say 2 laws with different age restrictions creates conflict and confusion.
I think it's very ironic that Wisconsin discovered the cases, but we're one of the few states that have not raised the age of purchase of tobacco to 21.
Luella Amos is one of the doctors at Children's Wisconsin who identified a disturbing trend among teens in need of intensive care for inflamed lungs 5 years ago. At the time, Children's Wisconsin says it treated 24 underage teens for severe lung damage, all stemming from black market vape cartridges. Dr. Amos is part of a team of pulmonologists who alerted the nation about the crisis.
Prevention might be our highest level of success right now.
And in the aftermath, she traveled to the Capitol to advocate for change.
I feel like we're kind of at a standstill now.
While Children's Wisconsin has seen far fewer cases of severe lung damage from vaping since 2019, the year the federal age requirement took effect, Dr. Michael Meyer says health concerns haven't gone away.
Children's Wisconsin doctors brought this to lawmakers' attention back in 2020.
Yep.
Nothing's been done about it. Is that frustrating?
I think it's amazingly frustrating. We learned this with alcohol consumption, right? Wisconsin no longer has just beer bars at 18, right? So it took away the ability of getting alcohol further away from children that are teenagers. We should think about the same thing in smoking.
Gina Larson with the Wisconsin Department of Health Services says 2 different laws cause a pair of problems.
I think there's a lot of confusion in the marketplace about whether or not retailers understand that they're obligated to follow the federal law.
In addition to confusion among sellers and buyers, Gina says police are unable to enforce the federal Tobacco 21 law because state law isn't aligned. She leads a program that sends students ages 16 to 20 into hundreds of stores each year to find out how often sellers are out of compliance.
That rate has gone up quite dramatically since the pandemic. We had gotten that number down to 5.5%. And our most recent 2023 numbers from a November report from November 2023 showed 13.6% of sales are to underage people.
Wisconsin is one of only 7 states where the legislature has unsuccessfully attempted to match the federal Tobacco 21 law.
It's not the state legislature intent to see any child harm, but yet they're being harmed, and they're being harmed from tobacco products.
State Senator LaTanya Johnson says there's a lot at stake if they don't act soon.
We have to give law enforcement the ability to be able to enforce the law locally and statewide. And right now, that's age 18.
Children's Wisconsin doctors say even 5 years after teen vaping lung injuries were first discovered, the long-term effects remain unknown. Pulmonologists tell me it could take several decades before that question is answered. Reporting outside Children's Wisconsin, Ben Jordan, TMJ4 News.
And as of today, the Wisconsin Tobacco Quit Line has expanded its text-based Live Vape Free program. The effort now offers help to young adults between the ages of 18 and 26.